There's 4 people here and 2 people here.
According to the World Health Organization, 1 in 5 people will face cancer during their lives, and millions die from it each year. Likely everyone here knows someone who's had cancer, but few people actually know much about it. I'm majoring in biology at Purdue and conduct cancer research on campus. Today, I'm going to be teaching you more about cancer by walking you through the biology of cancer, some of the most common treatments, and explaining why we still don't have a cure. To begin, let's discuss the biology of cancer. Cancer is a set of diseases caused by DNA mistakes or mutations within your cells. According to a 2022 publication out of the academic press, components of tobacco, UV radiation, and viruses like HPV are all common carcinogens or substances that cause cancer-initiating DNA mutations or DNA damage. Cancer-initiating DNA mutations can also be passed down through families, or they can be spontaneous mutations that simply happen on their own. After cancer cells acquire these initiating mutations, they divide rapidly, which causes more DNA mistakes or mutations to occur. Cancer cells with mutations that allow them to better survive and multiply establish into tumors. This can be likened to the phrase survival of the fittest, which applies to animals in the wild. Certain animals have traits that give them a survival or reproductive advantage, allowing them to pass these traits on while other animals die off. This is similar with cancer cells. According to a 2011 article from Hanahan and Weinberg, cancer cells have several common traits. I mentioned that they divide more than normal cells. They also become migratory and colonize other tissues away from the original tumor in a process called metastasis. Cancer cells crowd out healthy cells, which makes cancer so deadly. Now that you understand some of the basic biology of cancer, I'll walk you through some of the most common cancer treatments. Surgery and chemotherapy are considered traditional cancer treatments. Surgery has existed for centuries and involves physically cutting out the tumor. Chemotherapy was first developed in the 1940s, according to that 2022 academic press piece, and chemotherapeutics target and kill cells that are dividing. This makes cancer cells a major target. Cancer therapy is moving beyond these traditional therapies with next generation strategies like small molecule inhibitors and immunotherapy. According to a 2024 publication out of Signal Transduction and Targeted Therapy, small molecule inhibitors inhibit or halt the activity of molecules that promote cancer, while immunotherapeutics focus on reinforcing the body's natural defense mechanisms. You can think of your immune cells as soldiers. Like an army, they attack invading bacteria, viruses, and even cancer cells. Immunotherapeutics can increase the activation of immune cells or enable them to better infiltrate or break in to a tumor and destroy cancer cells. Now, I just mentioned all these treatments, but we still don't have a cure for cancer. It's important to understand why this is the case. One of the major reasons for our lack of a cure is due to different mutational profiles in different cancers, as well as therapeutic resistance. Because cancer can be caused by so many different DNA mutations, whether they be spontaneous, inherited, or caused by carcinogens, each cancer is different, and the mutational profiles or types of mutations are different in every tumor. Additionally, even if a therapeutic does work, which it might not for every cancer, therapeutic resistance is a main issue. According to a 2023 publication out of cancer drug resistance accounts for 90% of cancer patient deaths. Metastasis is another reason for our lack of a cure. Once cancer metastasizes, it becomes difficult to treat. According to this 2023 article out of Cancer Research and Treatment, patients with stage 4 metastatic NSCLC or lung cancer have 5-year survival rates of just 10% relative to 82% for stage 1 patients with little to no cancer spread. Diagnosis during these late metastatic stages is common, partially due to lackluster screening or early detection across the US. In the South, for example, we have one of the lowest annual lung lung cancer screening rates at 1.7%, despite there being the largest number of American tobacco smokers there, according to a 2023 article in Cancers. Now, in conclusion, cancer is incredibly difficult to target, yet innovative therapies are constantly being developed. Today I taught you about cancer by walking you through the biology of cancer, then the most common cancer treatments, and finally teaching you why we still don't have a cure. I hope you come away from this presentation understanding a little bit more about this prevalent and deadly group of diseases so that you're more prepared if cancer ever stares you in the face.